Hi, I'm Julia. I live in Pittsburgh. I went to nursing school at the University of Pittsburgh, and my dad lives in New Hampshire, so that's how I decided on UNH. I work in an emergency department at the Women's Hospital here, and we see a lot of OB and women's health related problems. However, we do sometimes see higher acuity patients that we need to stabilize and later transfer to a trauma center. So, I want to become a nurse practitioner because as a nurse, I always want to know why orders are made, why I'm giving certain medications, and why a certain plan was made. I want to have a deeper understanding of pharmacology, physical assessments, and increase my clinical judgment skills. In addition, having a nursing background, I know what bedside care is like and being on the other side interpreting orders. So I believe I will be more cognizant when placing orders and, above all, having the communication skills to build rapport and trust with my patients and family members. An interesting fact about myself is I like to knit and crochet, specifically clothes. I learned how to in high school and I've stuck with it since. So, to introduce myself to a patient, I would say, "Hi, I'm Julia. I'm a nurse practitioner caring for you, and I will be admitting you." I will ask you a bunch of questions about your past medical history, any medications you're taking, your family and social history, and at the end, I will perform a physical assessment. I've read your chart, however, I want to hear from you what led up to your hospital visit. Do you have any questions for me before we begin? And if the patient asked what exactly my role is as a nurse practitioner, I would say that as a nurse practitioner, I am an advanced provider in which I can diagnose patients, prescribe medications, order and interpret lab work and diagnostic tests. And specifically, as an adult gerontology acute care nurse practitioner, we specialize in the adult population, so young adults to geriatrics, with critically and complex health conditions. So I'm currently in Pennsylvania, which is a reduced practice state, and this requires a collaborative agreement with another health provider for the nurse practitioner to provide care. And another potential state I might practice in is California, which is a restricted practice state. It requires supervision, delegation, or team management by another health provider for the nurse practitioner to provide patient care. So, these requirements can impact daily work by limiting authority and autonomy and potentially delaying patient care. A pending bill in Pennsylvania is Senate Bill 25, which aims to create a pathway for nurse practitioners to achieve practice authority, and there is a transitional period in which the nurse practitioner must complete a 3-year, 3,600-hour collaborative agreement with a physician before they can practice independently. I look forward to this course because I'm excited to start a class specific to the adult gerontology acute care program, and I look forward to learning more about differential diagnoses and creating patient treatment plans.